So is your plan that you want to try to get back to Virginia to see what the physician there would like to do?
How do I do that now that y'all have messed up everything with my electrolytes to the point where I need infusions every day? But you won't give me my fluids. Y'all resuscitate me at night because my blood pressure drops. You know that's the indication for my fluids, right? Is my hypotension.
Yeah.
You know, like I don't have any blood volume, and it's half the reason why I don't feel good. The other day when PT came by, I couldn't figure out why I didn't feel good till we sat down and took my blood pressure, and it was in the 70s.
Yeah.
So, you know, can I not get my scheduled? I've got 3 bags sitting with my name on it at Village Point. Like, I don't understand what the point is in me not being able to get one of them, because I'm supposed to be getting one right now.
I know. I literally can't order.
Like, but I don't understand how not. It's my prescription, and I should be getting it right now. Like right now, I should be getting it. And it's half the reason why I don't feel good.
Yeah.
Is because you can't expect me to eat all this food while shoving this down my stomach and filling it with fluid.
Yeah.
Okay, so how do you want me to eat and shove all this stuff down there and then stay hydrated when I haven't been able to start a stream in forever without hesitation for like 5 minutes.
Mm-hmm.
I sit in there on the toilet needing to pee, and I literally cannot start a stream.
Yeah. What I think we should try to do is, if you're not willing to do a PEG tube, then I think we should take this Dobhoff tube out and let you try eating instead of, like you said, just filling your stomach. One, then you don't
Eating
have to be uncomfortable.
doesn't work because it stops moving. I came in on diarrhea. This is not normal.
Yeah.
I came in on diarrhea. Otherwise, before that, I was gastroparetic. But I started being able to move my bowels when I restarted the diflucan.
Mm-hmm.
It's just I haven't eaten anything in like 6 days.
I know. But like you said, this thing's keeping you full. So there's 2 options. One, I can make it so that it only runs at night, and then we see if during the day you're able to be a little hungrier to eat. Or we just stop it.
That doesn't help the solids moving.
Yeah. Have you been taking the Glycolax?
No, I don't. See, there's the cycle. There's the vicious cycle. Gastro wants me to take like up to 7 different types of make-you-goes to get a go, which sets off my kidneys, which sets off dehydration, which sets off my electrolytes, which then makes me have heart palpitations and heart problems, which sets off my dysautonomia, my neurological conditions. You know, like,
it is. You're in a vicious cycle. But we
and
have
on
to find a
top
regimen
of
that keeps you
on top of
regimen.
the fact that I have no endocrine system.
Yeah.
You know, I
You
don't.
gotta
I
find
mean,
something that at least keeps you regular.
No.
If a bowel movement's once every 3 days, like, I'd be okay with that even.
No, it's not okay to go every 3 days, and as long as I disturbed my electrolytes, yeah, sure, okay, I had a bowel movement. What do y'all want me to do? You know, ID, that's not a consult. They came down here to tell me that I don't have a fungal issue, and that it's old and it's a titer. It's just showing that I've been exposed at some point in my life. Okay, well then, why have I never taken diflucan in my life before? Never had yeast problems in my life before, until surgery. Okay, like I wasn't one of those women that's prone to UTIs or yeast infections.
Sure.
Now I can't get rid of them.
Okay.
So
what would you like to do tonight with this tube feeds?
Just wanted.
You want me to pause them until tomorrow to see if we can get you to have a better appetite for breakfast? I'll check your labs tomorrow morning, and we'll go from there.
What did they even show today?
Let me pull up my iPad where I just said that.
Because my bowels have not made a sound in 2 days.
Yeah.
And gastro hasn't been by in 2 days.
So your potassium was 3.7 and your mag was 1.7. Numbers that are essentially normal. Nothing that we need to do about. I can check labs again tomorrow, and we can hold tube feeds to see if you'll be able to eat, but that's
And then what?
pending that you really have to push things tomorrow.
Then what?
Then-
Then you drop me on my butt on Thanksgiving holiday weekend after being refed, and I have to get rid of my primary, and I need to get to Virginia.
Yeah, I don't know how to get you to your goals other than to find a way to get you out of the hospital. The best way to do that is to get you to a point where you're maintaining your nutrition by yourself. Because otherwise what I see happening is that things gonna continue to go poorly and you're gonna want to leave AMA, and then I think you're gonna be in a worse place than if we tried to find a plan together.
Well, nobody's been really working with me. I got told what to do. I get told what to do.
Yeah.
And this isn't a collaboration. This is what's happening, or you can leave. And that's what I get every single time. This is what is happening, or you can leave. They want me to leave. They don't want me here. They kicked me out of here 3 months ago for failure to thrive. They cleared me of it, said I didn't need any help.
Mm-hmm.
Yet here we sit.
Yeah.
I try to prevent things, and y'all don't listen.
What would you like me to do with your tube feeds tonight? You want to keep them running, or am you going to pause them to see if we can get your appetite better for tomorrow?
I don't have an appetite. That's the problem.
I know, that's what I'm saying. If we pause this and don't have your stomach so
I don't
full.
have an appetite before this.
Well, then you really need to think about whether you're going to be willing to do a peg tube to get nutrition then.
Why would I let somebody stick something else in my body that they didn't take care of the first time? The reason why I'm in this situation.
Because there's no other way to get you nutrition.
But you're sticking something else in my body, and everybody abandoned me and called me crazy after that. And now nobody will help me. And you really want me to put something else in my body that somebody has to surgically remove?
It's the only option for tube feeds out of the hospital. I called my social worker again.
And I don't know why I see everybody walking around with one of these hanging out of their nose. Lots of others doing those patients, and the like have them.
Okay, well, what I'm gonna talk to my night team about is if you decide to want to pause them, that's okay with me. And if your blood pressure gets with a MAP lower than 65, that's when I'm able to give you fluids and we can order it. They'll order it.
I have a prescription. You're denying me my prescription.
Okay. Did your husband bring your Prucalopride up?
No,
Is he coming back up tonight?
I don't know.
Okay. All right. I'll see you in the morning then.
What are we doing?
I'm trying to figure out a plan with you, but you're not telling me what you would want to do. Because right now we're kind of talking in circles.
Yeah, because nobody's listening. I'm trying to tell you. I don't know what it is. But I was gastroparetic for 10 months. And then I take 3 days of Diflucan and I shit my pants off.
Mm-hmm.
And everything clears. My vision gets better. My hearing pops like I got off an airplane. My vag starts flowing. My skin gets soft and moist. I turn colors like I have color.
Mm-hmm.
They took it from me downstairs, so now I haven't had any for a few days. So I've had a couple, but you got to give it a few days before it kicks in now, because I'm resistant to it.
Yeah.
But no, the only person who's ever even ran a test is in Virginia, and at least he knew to run that kind of test. And I don't know why he ran that specific one, but it shows something. Otherwise, he wouldn't have run it. He at least listened to my story.
Okay,
Nobody else will listen. Your ID team has had a preconceived notion about me since March. They never wanted to schedule me. They never wanted to see me. They never wanted me as a patient. So offer her something that she's not going to take, and she'll leave. And she's somebody else's problem. The only problem is y'all got me trapped out here. I'm out in the Midwest. Where do you want me to go for care? Y'all got me trapped to CHI, who tried to kill me during surgery and after, multiple times. Y'all haven't done a great job yourself, sending me home suicidal, literally with no assessment, by PPD, not even just your security. They call it OPTD, to escort a suicidal patient off their property.
Was that your admission a couple months ago?
No.
I think I read that discharge summary with family medicine.
No. I wasn't even assessed. No, that was a couple months ago. That's when I tried to get admitted for failure to thrive. And they threw my ass out on my nightgown and told me I could wait downstairs in the lobby in the DOC for my husband, who had just left for Kansas City for work.
Mm-hmm.
Because, waiting in your nightgown downstairs in the DOC cafe, that's lovely.
Yeah, it's not dignified. Okay.
Yeah, well, that's how I've been treated for a year. And so when I'm a little scaly towards medicine, people wonder why.
I don't blame you. I'm going to keep trying to work with you, but I need you to try to get better nutrition in your body, okay?
Well, I told you how.
If you're not going to do it with a PEG tube, then I think we need to remove the Staubhoff tomorrow, and we'll talk about that tomorrow.
But, okay, but listen. I let people talk me into the surgery whenever I was going downhill, and I told them I was going downhill.
Mm-hmm.
I was starting to need ringers, and I was going malnutrition again. And I could have canceled this surgery that I had in November, because I had lost almost 20 pounds by then, in 2 months. Everybody told me to proceed. Where everybody at? No, they don't want to help me pick up the pieces.
Mm-hmm.
Everybody said, go ahead, you're fine. Nothing will happen. You'll be okay. It'll improve so many things. And what did it improve exactly?
Yeah.
I've become an invalid who can't even be trusted to walk around the room by herself.
Okay, Angela, I'll see you tomorrow morning. Try to get some rest.
Is Gastro coming?
They started a note, so they better. But I don't know.
Well, what do you mean you don't know? They're part of my team. Should they not stop by? They didn't come yesterday.
Yeah, it seems like they're going to, because a resident has started a note, which means that the team's going to round on you. But I don't have control of that situation. That's not my team.
What do you have control of?
I have control of your orders, and then I'm your internal medicine doctor, so I get to make the final decision on what we do with things.
And why couldn't I have Gas-X earlier to see if it helps my stomach pain?
You can have some Gas-X.
The lady said I couldn't.
Well, let me put it. I'll put in some stuff for gas. Have you ever tried Bentyl? I think that's probably better.
Bentyl's not good for me.
All right. Let me look at what we can do. Okay. Then have your husband bring up that Prucalopride, because I think that'll help the most.
I'm not gastroparetic.